I'm Stefan Marciniak. I'm the Professor of Respiratory Science at the University of Cambridge, and I run the MB-PhD program in Cambridge. And I was a member of it many, many, many years ago. I went to an ordinary state school in Nottingham, which is a little town in the middle of the UK. I was the first person in my family to go to university, so I had no clue. I liked sciences, and medicine seemed to be hard, so I applied for that. When I came to Cambridge, I quite enjoyed it, and Cambridge were just about setting up the first MB-PhD program in Europe. They had been going for 30 years at that point in the US, but it was new to Europe. So I was in the second official year of the MB-PhD program in Cambridge. So I did a 3-year PhD in the pharmacology department, cell biology, and then I finished my course. So that was 9 years. It completely depends on the person. So somebody who wants to do a very clinical PhD, there's no advantage of doing it early, none. And in fact, it's disadvantageous, because if you do a clinical PhD early, when you think you know everything, but you know nothing, you can end up doing a PhD on the wrong subject. And so if you want to do something clinical, wait until you're more senior, and then you're terminally differentiated down one lineage of medicine, and that's fine. If you're simply interested in the basic science, and you also happen to do medicine as well, like me, then it really doesn't matter. You might as well do it early. In the UK, most people do their PhDs, their medics do their PhD much later, when they're quite senior doctors. And the problem is, you go from being a very senior doctor who's running the show, who knows what they're doing, to being a first-year PhD student who knows nothing and keeps forgetting where the DTT is kept and everything. Doing a basic science PhD is great. And also, if you do a very basic science PhD, you can make it adapt to whatever specialty. I thought I wanted to do pediatrics, and I was wrong. I'm a respiratory doctor, but it doesn't matter, because I did a basic cell biology PhD. Even if junior doctors don't get academic foundation jobs, there are still many, many opportunities in the UK to do PhDs later. So the disadvantage is you're a bit older, but the advantage is you know what area to do it in. But for basic science, it doesn't matter. You can do it early or late. So the MB-PhD program in the UK is now about 33 years, in Cambridge is 33 years old. When it was 30, I did an analysis of our previous 200 students. And I contacted them all around the world, and it was very interesting. Most of them were still doing research. Half of them had university positions, and half of them had health service positions. Most of them were doing medicine, and most of them were doing research, which was interesting, because people say, MB-PhD students, they don't continue medicine, or MB-PhD students, they don't continue science. The truth of the matter is, we continue both. But what is interesting is only half of them were working on the same topic they did their PhD in, which is either a positive or a negative. The negative people will say, see, it's a waste of time, they should have waited. But the positive people say, well, actually, a PhD is a basic science training. It teaches you to analyze, it teaches you to design experiments, it teaches you a few techniques, but the techniques you learn now will be different in 10 years. So I don't think it matters. So there's the data. The data is we all continue doing science, most of us, but only half of us continue on the same topic. So I did a PhD on secretory vesicles in the pancreas. So according to that, I could have been a gastroenterologist. I'm not interested in that. I'm a respiratory doctor. But my lab studies cell biology of the secretory pathway. So it all seems to make sense. You know, I did a basic science PhD in secretory vesicles, just happened to be in the pancreas. I now work in the thorax. It doesn't matter. The trick is to pick something that you're really interested in, that you are happy to be working in that vague area, and you will change your mind, probably. I always joke that I do 50% of my time research, 50% of my time medicine, and 50% of my time teaching. My contract says 50% clinical and 50% research. I do most of my teaching in the evening. I've just done a clinic this morning. And although I wouldn't recommend people working all weekend, if you're doing really fun science, reading papers and writing papers at the weekend, and again, I'm not saying that you have to do this, but if you're really, really doing some fun stuff, it doesn't seem like work. I I probably am getting more sensible about protecting my time now than I used to be. I used to work crazy hours. I would, work the 12-hour days and then all weekend and things. It's not sustainable. It's not healthy. You can ruin your family life by doing that. COVID has taught us nothing. It means that working without a break for 18 months is stupid. I think it depends on your specialty, but for a physician, I'm a physician, not a surgeon. I think being kind is the most important skill, because even if you can't do anything for your patients, and there are lots of patients we can't do anything for, they feel better if you're kind to them. A second is being thorough, being bothered, is making sure you check all the results at the end of the day, that you just complete all your letters, that you actually get everything done. Enthusiastic, because if you're enthusiastic, then you will do all the other things that you need to do, which is spend all your time reading and keeping up with the literature and discussing with your colleagues. People will say, gosh, how do you read all those papers? How do you keep up with the field? I do it because it's really fun and I'm very interested. If it wasn't fun and I wasn't interested, it would be tedious to read loads and loads of papers. If you want to be really, really deep about it, the important thing is try and pick a big question to answer and use your career to answer the big question. I don't think I've done that. I've been completely just pulled in all sorts of directions by things I'm interested in. I think if I had my time again, I would sit down and I'd think of a really big question I wanted to crack. As it is, I've just been having fun. Friends of mine like David Lomas, he spent his whole life looking at alpha-1 antitrypsin deficiency and is now at the point now where he's been able to influence drug development. Another friend of mine is a chap called Nick Morell. He is just interested in the pulmonary hypertension. So he's been working initially on physiology, and now he's sorting out the genetics of the disease. And I envy those people because they've got one thing and then they know what they're aiming at, whereas I go in all sorts of directions, whatever I find interesting. There are different approaches. There is no point in picking a lab just because you think it's got a great name, but you're not interested in it, because most of your experiments, if they're worth doing, won't work. We've all had these periods where nothing's worked for 6 or 8 weeks and it's miserable. But if the work you're doing is really, really fun and the lab is really exciting, you'll still want to go even if nothing's working. On the other hand, if you're going to a lab and they tend to publish well and exciting work, it's quite likely you'll publish well and do exciting work. If there is a lab that doesn't publish very often and their work isn't highly cited, you really need to think very seriously, is this the right place for you? You're not going to a lab simply to make friends. Some people will pick a lab because the supervisor is really charming and you're going to have a great fun and they do lots of parties. That's fine. It's great if a lab does that. And I try to do that with my lab as well. But that's the secondary importance after the quality of the science. If a lab is tiny, there's not enough people, if there's not a critical mass, it's a problem because you're not going to have many people to learn from. If a lab is too big and there are 50 people, the chances are you're really not going to be working with the person you think you're the big boss. I think it's a great idea and it's incredibly fun. People who do nothing but medicine, I have great respect for them, but I think I would be too bored too quickly. So I think doing science is fantastic because it's completely different to medicine in that in medicine, you're following protocols. It's still whodunit and working out what's going on. But most of the time, you will be doing things that people have done before. In science, it's creative. It allows your creative side to grow as well as your thorough side. I think it's possible to do both very, very well. When you're doing medicine, you're judged by the medics, and they will think that you're just playing at doing medicine, so you have to do it better than they are. When you're doing science, they'll think you're just a medic playing around in the lab, so you have to do the science at least as well or better than they are. As clinician scientists, we have time to take a step back and think, well, this is great, but how could we do it differently? What can be improved? What can be changed? We're not simply following what everybody else is doing. And so you'll often see that the medicine that's being done by clinician scientists is innovative because we're used to innovating. That's what we do. And in our labs, we'll be doing basic science, but we'll also have I think medicine training gives you a really broad biomedical knowledge. You might not do pure biochemistry, but you will understand the place of biochemistry within cell biology, within physiology, how it interacts with pharmacology. Because we have a broader knowledge, we're not simply focused on one small area. Some of our most fun papers have a bit of medicine, a bit of cell biology, and a bit of physics. We have a lot of collaboration with engineers, because if you're siloed in one little area, you can miss advantages of working with other specialties. And medicine is all about that. So I think I just say, stick with it. It's the most fun career you can possibly imagine.